and Work Incentives Improvement Act. One of the unfortunate things that we can talk about a little bit more, and I'm going to defer a lot to Jill and to Berthy about this because they're the true experts in this program. There's been a lot of discussion about why so few people are using their tickets to do training and get training through the employment networks. And there's been a lot of discussion about why the employment networks, why more businesses aren't becoming employment networks. And we can go over that. Unfortunately, as you can see on page 6, I think it is,
slide number 6.
Slide 6. There's a very low participation rate. As you can see, it's still about 1% of the people that are holding tickets are using them. So we have a significant issue there. I think slide 7 is very interesting because it discusses what type of limitations people have on their employment. And I think that does matter when you're looking at what types of things will cause you to not be able to work. And you can see that the two largest categories are mental illness and then the musculoskeletal are the two limiting factors. Then we did a breakdown, too, of the participants, just looking at the participants in the Medicaid buy-in programs. And this is using the Ticket to Work research files. And you can see that there it's holding true, that there's 31% are individuals with mental illness or other mental disorders. And then between the all other and unknown categories, that makes up the bulk of the others. Many of the disabilities, as you know, it's hard to put into types of disabilities such as this because there's co-occurring disabilities, and then how do you determine which one you would put down as your primary disability? So I think that some of these are, good for illustration, but it's hard to really determine what we're talking about in this category. As you can see, in the Medicaid buy-in program, there's 32 states with active buy-in programs now, and there's a little under 100,000 total in the United States in 2004 participants in the program. And then on slide 10, there's a breakdown of how long individuals stay on the buy-in program. There is some cycling on and off of the buy-in programs for individuals with disabilities. One of the things that we have learned from our work with the individuals with disabilities in the Center for Workers with Disabilities is there's an awful lot of going in and out of the workforce based on different periods and times of the person with disabilities. In my own son's case, we've been fortunate that his medication has been stable for the last 2.5 years. But prior to that, we had a lot of times when I'm sure that he couldn't work full time. And I think that happens with a lot of people with disabilities, that for whatever reason, their medication or whatever, they have to cycle in and out. So in basically, that's what we wanted to go over was some of the foundation that was there and some of the primary focuses of one of the things, or some of the things and issues that cause the difficulties with the programs that are currently in place. And I will turn it back over to Wendy.
There were 3 points specifically that came out of your address, Martha, and I'd like to kind of put them down. One point was infrequency of use. So if we have a low percentage of use, an infrequency of use with regard to the service providers, that creates problems. Because clearly we're talking about level of knowledge and education, and those were the barriers that you were hitting. There also was kind of a secondary issue that came out of that, and that is the vacillation of people with disabilities within the workplace. And it may be due to medication, it may be due to family circumstances. There are a myriad of reasons why workers will enter and then exit and then seek to re-enter again. So using that kind of as a launching pad, what other types of things are you seeing in your respective work that are mentioned within these two specific issues that we've documented so far? Yes?
Actually, I'd like to add a third.
Okay.
Okay. Illinois operates a Medicaid buy-in program, and we have at the lowest income threshold in the country. It's a 200% federal poverty level, so obviously people cannot earn very much. But we asked them that question. This was not a scientific survey. This was simply, to a great degree, we would call individuals who left our program. And one of the things we heard time and again, it was the kind of job they were able to get because of the income capping. And whether it's 200% or even 300, these were not careers. These were people who were working in entry-level positions, not very ambitious for people especially who had a lot of other capabilities. So one of the reasons that they went in and out of our program was because they thought, and I'll put it very succinctly, with one individual told me on the phone he was annoyed. He said, well, if you had a crappy job like I did, you would constantly be looking for something different. So in that instance, these weren't careers, these were jobs. They didn't pay very much. It was not something that they looked forward to or thought about what to do with the skills and talents they did have. So I think it's the nature of the employment because of the way we maneuver the system.
Pat, while we're in that arena, can you speak to how that could potentially change?
Yes. I guess going back to some of my initial comments, I think that we need to look at disability differently and as a continuum, that people have a variety of disabilities. I would venture to say that every single person in this room has some kind of a disability. It's a continuum. At some point, if you cross the line, you have a disability. Like Martha said, ginormous binders, and in that, some sentence told somebody that this person had that severe impairment that was going to last for 12 months or result in death. I think we have to rethink what it means by a disability, rethink the kind of supports, make them available to individuals, and to offer employment, and I'm going to go one step further, make employment an expectation, not an option for people with disabilities. It's not an option for anyone else. It's an expectation, and that demands a tremendous cultural shift. So I'm going light years into the future here. But I spoke to a group once, and I said that, and one individual, one young man in a chair in the front row said, but I don't want to work. And I said, that's great. Solid mornings, I don't want to work either, but it's not an option for me. And it shouldn't be an option for you because I don't think I should have to support you if you have talents and skills you can contribute. So I say that goes to entirely, and if we don't do it, if we aren't the visionaries, it ain't going to happen.
So we have a jobs program, not a career. We have an interruption of a continuum, yet we seem to have a population that would like to have a continuum. Is that what we're hearing? What else is going on? Yes. Berthy. Della Rosa Aponte.
That's right. But just Berthy is a whole lot easier. You know, one of the biggest barriers that we have is that our economy has changed, but we have not changed the way that we have done things. If you work, you're not disabled. But if you don't work, then you're disabled. And back when, the programs began, we had an agriculture and a manufacturing economy that really people with disabilities couldn't work. But today we have an information and a technology economy. So people with disabilities can work. But if they work, they're not disabled. And I just give you an example. I live in Florida. You all know we have hurricanes. Last year in my neighborhood, Hurricane Wilma came by, and we lost a lot of trees. So one day I'm driving into my street, and there is, they had cut the tree, so they had to remove the stand of the tree. And there was a little caterpillar, like a robot type of machine. And there was a guy with a button and destroying, this, making it a mulch. And I'm looking at the guy and I said, look, 20 years ago, you needed somebody very strong, with all of their senses in order to be able to take, that tree. I mean, you had to have a lot of muscle. Today, the guy was just standing there with a little button, and that was happening. So people with disabilities can do that. But we continue to, go by, our rules are the rules of the past. We have not changed them. So we have to look into that.
Are we talking about semantics here?
No, we're not
We're talking about evolution here?
No, we're talking about reality. We still live by the rules that started when we had an agriculture and a manufacturing economy.
So we basically have rules that are creating barriers as a result of language within the rules?
Yeah.
As a result of perhaps failure to look at jobs in a different way?
And we have tried to deal with that by creating all of these work incentives, so that even though, you're still disabled, but if you use the 1619 A and B, or if you use the pass or whatever, you can still keep the benefits. But people do not trust. There's no trust. There's absolutely lack of trust. They think that I'm going to do that, but it took me so long to prove that I'm disabled, like a couple of people have said that, the minute that I work, I'm going to lose my health insurance and I'm going to be in big trouble because I'm not going to be able to get it again because now I'm not disabled anymore. I was able to work. And I need the health benefit in order to live. If I don't have the health benefits, I'm going to die.
So you're saying that the system does not foster trust, and therefore it may be respective of the low usage of the system because people do not trust that it will provide for them?
Yeah. And a lot of it has to do with the experience that Martha said. You know that something exists, but then you call, and those experts, so-called experts, are telling you, no, this is not the case. So people get confused. You go in one office of, whether it's a government agency, whether it's a for-profit or non-for-profit provider, and you go in one office, and you go from one person to the next person within the same office, and they're giving you different information.
So,
and you, the consumer, don't know what's the real truth, and what do I do?
So there's inconsistency in education?
There's total lack of qualified, trained providers at the local level.
So qualified, trained providers and consistency of delivering communication across the board.
And not because people mean bad. It's just that they don't know. Some people don't know.
Yeah. I saw someone over here. Yes, Steve?
Hi. I think one of the, we always like to think out of the box, and try to understand where the future is. Well, this country is definitely coming up against, and we've been hearing this quite some time now, as the baby boomers retire, there's going to be less and less folks to replace them that are college educated. And I know Raytheon in particular is seeing a very dire need in this area of math and science. We need engineers. We need people that want to be engineers, and they have to be U.S. citizens too. And it's going to affect the nation's security. And it's something that is so important to get across. I'd love to see colleges and universities work harder to get folks with disabilities degrees in whatever education path they want to follow. But I think that is the answer to getting them higher paying jobs, to getting them off Medicaid, because now the company's paying for their health insurance with them. So, and I think corporate America is selfish. And there has to be a need for us to drive a solution. Well, there is a need now. We need workers, and we need to drive the solution, and that's going to be getting college educations out to folks with disabilities and then getting them into the work